How did the pharma company, let it be Johnson & Johnson or Merck or GlaxoSmithKline or Novartis or Aventis, how did they make it? How drugs are being made? And I think that this is fascinating. It's not only fascinating because we are consuming drugs and we, in many ways, our life, even of the healthy people, and I'll show you later on, the very healthy people, is completely dependent on drugs, not to say the life of sick people, but also I think the development of drug is a paradigm to the connection between basic science, between the scientists that are working in the lab, to our daily life. This is really the translation of the discoveries that are being made in the universities, in the laboratories, that make it all the way basically to our kitchen. Well, it's not exactly the kitchen, it's the cabinet in the bathroom. But I don't think that there is a single person here, from the youngest little girl that sits here up to the oldest person that sits here, that doesn't have or didn't try a drug in his lifetime. Let it be a small child that just had a fever and had to take some paracetamol or just an antibiotic to combat an infection, or more older people that are using all kinds of drugs to combat either acute diseases or chronic diseases. So drugs affect the lives of each and every one of us in the Western world with no exception. And therefore I think it's very challenging to understand how they make their way into our cabinet. And what I'm going to present you today is my own view, but I think that it's more or less a reflection of modern history. And I'm going to tell you a story in three layers. I'm going to tell you the story of the past, I'm going to tell you the story of the present, and I'm going to tell you the story of the future. Now, the story of the past is about, I would say, 70 years old, because until 70 years old or 100 years old, there were no drugs. I mean, there was not systematic drug industry. People were using all kinds of plants. They went to barefoot doctors in China or to some witchcraft doctors here and there, but medicine was not that systematic as we know it today. People had Chinese traditional medicine, but evidence-based medicine that we know that if we take aspirin, our fever will go down almost no matter what, is something very novel to us. It's about 70 to 80 years old. So I'm going to tell you how the first drugs came into the market, how we are doing drugs these days, and how drugs will be made in the future. But for the future, we should also discuss together, and if you later have questions, I'll be more than happy to answer them, and I'm sure that Maria Garcia, who is in the same profession in medicine that I am, will also help me in the discussion. We are going to see that as fascinating as it is not free of problems, and there are many bioethical problems that will go hand by hand with development of drugs in the future. So let's go into the topic, let's start to, and I'll try to be as simple as I can, and I'm sure that many of you will share whatever I'm going to tell you, and I'll ask you from time to time to raise your hands, and you'll see how it is really flowing in your blood and touching your very daily life. And we are going to talk about drug discovery in the 21st century. And I call it the third revolution, but we'll first go to the first revolution. And the first revolution is what I call the era of incidental discoveries. And this was between the 30s and the 60s, when people, brilliant scientists, could see something that nobody else could see. But it was all completely incidental. There was some clinical observation, and this clinical observation from time to time went back to old Roman times. Well, we are in Italy here, so the Romans were here, to Greeks, to the Egyptians. They realized that some plants, if they eat it, they lead to reduction, to alleviation of pain, to removal of fever. But this was a plant, and they wanted to understand what is in the plant that will alleviate pain, that will reduce fever. And then they went and isolated the active ingredient, and they made a pill out of it. But only later, we started to understand the mechanism. So the discovery came first, and the understanding of the mechanism came later. And I'll give you an example. I think that examples are all the time better than just talking on principle. Let's take aspirin. It's a complex, picturesque kind of slide, but we'll go through parts of it and you'll see that you understand it. Aspirin. Everybody knows about aspirin. Actually, aspirin is identified with one company, Bayer. Everybody buys Bayer's aspirin. But basically, you can synthesize it in the basement. It's the most simple chemical almost available. It's acetyl salicylic acid. I will not go into the chemistry. Trust me, it's one of the simplest chemicals that we know that every undergraduate or high school student after 2 weeks in chemistry can synthesize it alone in the laboratory. Now, aspirin was known for centuries. The old Egyptians discovered it. They didn't know that they discovered it, but they did discover it. And they discovered it in willow barks. They noted that if they eat willow barks that grew along the banks of the Nile River, it takes away fever and it takes away pain. So they used it as a plant because most medicine, as I told you, was based until the 19th century and the turns of the 20th century on plants. And you'll see some other examples later. So it came from the old Egyptian, but nobody used it. It was very bitter. Don't try even to eat or to chew willow barks. And then at the end of the 19th century, a French scientist made it less bitter by making it, by changing it chemically, but then it died again and nobody cared about it. Until a Jewish scientist at the 30s by the name of Hoffman that worked in Bayer company had a father. And the father suffered from a disease that most of you know, and it's rheumatoid arthritis. Look at these hands. Look at these distorted hands. It's inflammation of the joints that completely debilitates the patient. It's an awful disease. It's not only painful disease, but the patients cannot walk because the hip joints and the knee joints and the feet joints are highly inflamed. It's accompanied by fever. The fingers are bending. We cannot use the hands anymore. It's an awfully debilitating disease. And the disease is accompanied by fever, but mostly by pain. And then Hoffman remembered the French scientist and the Egyptian that had these willow barks and the compound, and he said, let's try it again. He pulled it out of the drawer, and he gave it to his father. He purified it alone. He didn't go to his bosses in Bayer. He did it all by his own, and he gave the drug to his father. So he gave aspirin for the first time in the history of medicine to his father. And his father was almost cured. The pain was gone. The joints were not inflamed anymore. The redness, the swellness of the joint disappeared, and the father started to walk. It was like a miracle. Only then he went to the directors of Bayer and convinced them to turn aspirin, which again came from the Egyptians, into a drug. And they agreed, and aspirin became a blockbuster. I don't see you all here because it's dark, but will you please raise your hands, those of you that are taking daily aspirin? Are there people here? Yes, here, one. I'm the second one. There are more. Trust me. I'm taking aspirin too. There are about 10 people here. They belong probably to the little bit. They're not spring chickens anymore. They belong already to the older age. Aspirin is a terrific drug. I don't take aspirin. I'm a physician, so I am a great believer in aspirin. I don't take aspirin because I had a heart attack or anything. I take it as a preventive medicine. And we'll talk about it in a minute. So aspirin was started as an anti-inflammatory drug. It's probably the best fever eliminating drug, and many people are using it to eliminate fever. I take aspirin every day for the last 10 years, and I will probably take it through the rest of my life, and I'll tell you in a minute why. Now, aspirin is an anti-inflammatory. Now, there is a huge connection nowadays between chronic inflammation and cancer. It is clear that in many cases, people that are suffering from inflammation for many years will at the end develop cancer. On some of the cancers you heard, and on some you didn't hear. So for example, chronic inflammation of the intestine will lead at the end